Hello, I'm Dr.G.P.V.Subbaiah, spine surgeon, Hyderabad. Sciatica is a very common problem which we see in our day-to-day practice. Sciatica is nothing but back pain, and that pain is radiating down into the legs. There are various causes for sciatica. There are various spinal causes for sciatica, like if there is a disc problem or if there is a spinal stenosis, patients can have this back pain and radiating pain. But there are some other causes wherein there is no problem in the spine, but still the patient has this sciatic pain. This is what we call a piriformis syndrome. Piriformis syndrome is nothing but, if you look at the piriformis is a very small muscle deep in the buttock, and it acts as a external rotator for the hip joint. It's a very small muscle, but the importance of this muscle is the sciatic nerve just goes behind this piriformis muscle down into the legs. So if there is any condition which irritates this muscle, or which can cause spasm of this muscle, can irritate the sciatic nerve and can cause this sciatic type of pain, radiating pain down into the legs. So if you look at what are the causes of piriformis syndrome, first one is any injury or any trauma that causes spasm of this piriformis muscle. Second important thing is any person who is using a heavy wallet in the back pocket of his pants can irritate this piriformis muscle and can cause this sciatic pain. So that is the reason we always advise people not to carry heavy wallets, especially in the back pockets. So what are the complaints in a patient with piriformis syndrome? The important complaint is patient will have buttock pain, and that buttock pain will be radiating down into the leg. And this pain gets aggravated if the patient sits for longer periods, or if the patient walks or runs for long distances. And this pain gets aggravated if the patient is taking up or down the stairs. So these are the complaints of piriformis syndrome. So how do we make a diagnosis of piriformis syndrome? Purely clinical examination, and then by ruling out other spinal causes. So there are various tests to make a diagnosis of piriformis syndrome, but the important test is what we call FAIR test. Flexion, adduction and internal rotation of the hip joint aggravates the pain in the buttock, and there will be local tenderness deep in the buttock. So this is how we make a diagnosis of piriformis syndrome. So how do we treat? So just to reduce the inflammation of this muscle and spasm of this muscle, we give pain medication, and then we suggest some stretching exercises for these muscles, the piriformis muscle. So this should relieve symptoms in most of the patients, and those patients who do not get better with the medical treatment, so we give a local injection into this piriformis muscle, local steroid injection into this piriformis muscle. This is what we call piriformis myogram. And most of the people, they get better with this piriformis myogram. So this is what we call piriformis syndrome. And one of the causes for sciatica, non-spinal causes of sciatica, is piriformis syndrome. And we always advise people not to carry heavy wallets in the back pockets of the pants to avoid this problem, piriformis syndrome.